Career Day. Explore the possibilities and learn how to pursue your dreams right here on Career Day. Coming up, we're introducing you to some of the best health and wellness careers in America.
Today's patient is a 24-year-old female who's a ballet dancer.
Make no bones about it, an orthopedic surgeon is one of the highest paid positions in the medical industry. Find out how this specialist turned fixing bones and joints into his dream career.
People come in kind of broken up and shattered in ways, and we can fix them and get them back playing their sports or doing whatever they love doing.
Any sport has an element of risk. And when an injury occurs, it's this doctor's mission to mend it.
Hey athletes, if you get hurt, it's my job to fix you. Find out how on Career Day.
Dr. Richard Ferkel's a leading specialist at Southern California's Orthopedic Institute. He treats patients with various types of pain.
You wearing this boot?
Mm-hmm.
A lot or a little?
All the time.
Yeah. Show us how you're walking.
I'm an orthopedic surgeon. That's a doctor that takes care of bones and joints. People come in kind of broken up and shattered in ways, and we can fix them and get them back playing their sports or doing whatever they love doing.
From tennis pros to track stars, Dr. Ferkel helps patients of every age, and some are even famous.
Wow. That is great. That's a great shot of her. I'll have to frame this.
Take care of a lot of professional and college athletes, both in the NBA, the NFL, Major League Baseball.
Check out one of my athlete's shoes. This is size 17.
When he's not in the cast room or clinic, Dr. Ferkel's performing surgeries, a task that requires both precision and skill.
So today's patient is a 24-year-old female who's a ballet dancer. She injured it about 12 years ago and had surgery on her left ankle. She's done well until recently. The pain's gotten a lot worse.
A lot of bad things can happen in surgery if you let your guard down and you don't focus and really concentrate.
Like the players he treats, Dr. Ferkel's success is achieved by teamwork and a game plan.
The most important thing you can do is to be prepared so that it goes effectively and very smoothly in surgery without any, we call glitches or problems.
Now the ankle is a very tight joint, and because there isn't much space between the two bones, we use this little device called the distractor to pull the ankle apart, and that gives us more room. We need about 3 millimeters of room to get into the ankle joint.
To avoid making a critical mistake, he spends hours practicing each and every move before a surgery.
These simulators are good to practice on, obviously, instead of real patients. Real patients don't like being practiced on.
Okay, Career Day, it's time to go in the operating room. Let's go to work. So now we're going to watch TV to see what's inside her ankle.
This cutting-edge physician is also an acclaimed author and inventor. In fact, his innovations are used in operating rooms throughout the world.
If you injure your shoulder, there may be 3 or 4 different ways that we could fix it. And so we have to find the way we think is the best. So we invented all these cannulas. These are what's called a cannula, and that goes through to allow it to go smoothly into the joint without scratching anything.
Dr. Ferkel grew up with a passion for athletics and even played football in college.
I love doing it, but my grades weren't doing quite as well. I didn't think I was going to get into medical school. I was probably going to be a better doctor than a football player, so I decided I better get in gear with my grades.
After spending years pursuing his degree in sports medicine, he made it his career goal to help patients play without pain.
You haven't played soccer since when? March?
March, yeah.
What position you play?
Center, defense, and midfield.
Make no bones about it. Being an orthopedic surgeon is Dr. Ferkel's dream career, and it just so happens to be a lucrative one, too.
As long as she doesn't have any pain, it looks like, you know, it's healed up pretty well at this point. It's been 4 months. You're always learning, but you're doing fun things. You're taking care of patients. How's your reflexes? You got reflexes? Yeah. And you're doing what you love to do, so it's not really work.
We hope you were inspired by today's Career Day. And remember, it's never too early or too late to follow your dreams.